Hi everyone, I am Dr. Sandeep Dachuri, consultant ENT head and neck surgeon at KIMS Sunshine Hospital, Begumpet. Today we are going to talk about a problem called as sudden sensorineural hearing loss, which is the nerve loss in the ear. This usually happens in one side in 99% of the cases. Getting nerve loss on both sides is very rare. So how do we define this nerve loss or sudden sensorineural hearing loss? We define it as loss of 30 decibels of hearing in 3 consecutive frequencies which is developing within 3 days. So if it is fitting into this definition, it comes under sudden sensorineural hearing loss. What are the causes of sudden sensorineural hearing loss? Viral infections of the ear or bacterial infections, or is there any trauma, sometimes a head injury or a temporal bone fracture due to road traffic accident can induce sudden sensorineural hearing loss. Or sometimes if the patient is using some medication which are ototoxic, it can lead to hearing loss. If the patient is suffering from some autoimmune condition like SLE or Wegener's granulomatosis, they can develop sudden sensorineural hearing loss. Or if they are immunocompromised, they can also develop hearing loss. So if the patient develops sudden sensorineural hearing loss, what has to be done? Initially, the main thing that patient has to remember is, if there is a sudden sensorineural hearing loss, if he can't hear in 1 year, the treatment should be given as early as possible. The earlier we give treatment, the better is for the patient and for the better quality of life. We have to assess the hearing with pure tone audiometry. Doctor assessment has to be done to thoroughly check the ear, to see the eardrums whether they are intact or not. Ear canal has to be checked. Then we do pure tone audiometry, check the hearing of the patient, and if suspected, we might have to do a MRI with contrast of the brain and the auditory pathways to check if there is something pressing on the nerve which goes from the ear to the brain. So once all these are done, and if the patient is not having any reason to develop sudden sensorineural hearing loss and nothing can be identified, then it is called as idiopathic sudden sensorineural hearing loss, which is very common among these patients. And coming to the treatment, if the loss is identified in the early part within 2-3 days, if we give treatment, they will have very good prognosis. And if the patient has got associated symptoms like vertigo along with hearing loss, the prognosis is poor. And if the patient is very elderly, like 80 years old, developing sudden loss, the chances of recovery are less. Whereas if a young patient with 20 years of age develops this kind of loss, the chance of recovery are more. There are multiple treatments available for this, but the main line of treatment for sudden sensorineural hearing loss are steroids. Steroids can be given orally or they can be given intratympanic. Intratympanic steroids are nothing but we give an injection of steroid, high dose steroid into the ear. We make a small hole in the eardrum and inject the steroid, and patient will be kept in a particular position for half an hour to 45 minutes, and during that time they should not swallow their own saliva. So intratympanic steroids are given at a frequency of 3 to 4 days, and 3 to 4 injections are usually given, and once 4 injections are finished, we reassess the hearing. So this is how intratympanic steroids are given. Whereas in oral steroids, we have to taper the steroids over a duration of time. Initially we start with high dose of steroids and gradually we taper the steroids. And the problem with oral steroids is there are multiple side effects of taking oral steroids, and especially if the patient is diabetic or elderly with osteoporosis, we cannot give oral steroids. For them, we prefer to give intratympanic steroids. There is another line of treatment which is hyperbaric oxygen therapy, where patient is given 100% oxygen and kept at a high pressure of 1 atmosphere in a high pressure chamber. But this treatment is not available everywhere. So only in centers where this hyperbaric chamber is available, we can treat them with hyperbaric oxygen therapy. Otherwise, steroids are the main line of treatment for sudden sensorineural hearing loss. Thank you.